before we can start actually heading up to altitude here. I know I promised you a little bit of pressure breathing today. Let's see what that feels like. Everybody take that red switch that's in front of you and move it down. No, I'm sorry, up to emergency. It's backwards from outside. It's like a mirror. And now you're feeling that pressure coming at you, right? Well, what everybody do right now is we talked about trying to talk against this amount of pressure before. So everybody come over the radio, give me your name and hometown against this pressure. Go ahead.
Stevie from E-Town. Daryl, Santa Rosa. Chris from Toledo, Washington. James from Wellington. Eric, Boise.
All right, so you can neutralize those switches right now. Everybody kind of got a feeling for what that amount of pressure feels like, right? Remember, when you are pressure breathing, it's the opposite, all right? So you want to avoid hyperventilation, kind of squared breathing. So take a breath in, then hold for 4 seconds, bottom of the square, exhale, side of the square, hold for 4 seconds, top of the square, take a breath in. So kind of squared cycle breathing is probably the best way to prevent any hyperventilation when you find yourself with that much pressure. What I want to do now is show you really what these regulators can do if you ever need it, all right? So this would be probably the pressure you get from an aeros mask, probably with a rapid decompression up above 40,000 feet or so. So what I want you to do, it's spring-loaded here, but I want you to grab that red switch and push it down. And just take a couple breaths off that. If it's overwhelming for you, you can always just let that switch go and return your breathing back normal again. You're going to feel leaks and pops and everything with that amount of pressure. It's completely normal. That mask can't possibly hold all that back. So what I want you to do, though, is press the switch down and then come over and we'll do a name and hometown again. We'll start with Stevie up here.
Steve.
All right.
Santa Rosa. Chris, Toledo, Washington.
All right, so now you definitely, Chris probably had the best sound to it, if you will. Kind of what's happening is your vocal cords are vibrating as you're getting air at you and trying to talk against you, so you get that characteristic vibration kind of noise with it. Everybody had difficulty with it, right? Now imagine you're trying to talk to ATC after a rapid decompression or some other event just let them know what's going on, all right? One, your voice is rather muffled. Two, it's hard to talk against that pressure, so you're going to need to kind of enunciate a little clearer, a little more equally, if you will, to kind of get that out. And then if you're trying to talk to your fellow crew members or passengers in the back, they may have some problems understanding you as well. So probably, though, if you had a rapid decompression where you get that much pressure, the guys in the back are probably asleep by now, and they'll wake up when you get that aircraft down to a more safe altitude. Got about 2 minutes left here. Just off the top of your head, anybody have any question on anything so far? What we're going to do after the chamber flight today is we're going to just kind of sit back here in the seats. We're recording everything. We'll review the video with you a little bit, give you a copy of the video, and then kind of adjourn from there. So we'll get out here. We'll get out of the chamber here for a little bit and kind of keep going. We'll talk about it more. I wish I had a joke. Maybe you know any good dad jokes? I'm always looking for some.
I've got one. Before I was a pilot, I used to work at an orange juice factory. But I got fired because I couldn't concentrate.
I have to write that one down. I like it. Why can't koalas fly airplanes? Because they don't have the qualifications. My career as a comedian had faltered quite rapidly early on. So a little review here of trapped gas issues, what you may see here. Anybody have any ear sinus problems in the rapid decompression before? All right, so you're probably pretty good. So just a quick review of trapped gas issues. Middle ear, probably the most common one. Everybody kind of has their pet method for clearing that. Sinuses as well. Oh, one thing I want to have you guys do is learn how to Valsalva with these masks on. All right, so everybody stick your index fingers up, one index finger each hand, and then find the soft spot on those masks. It's about halfway down your nose. Right, remember, no need to do it on a scent, right? A scent will take care of itself, but if you are descending and you need to clear your ears and your sinuses, that's probably the best way to take care of it with these masks.
You really kind of got to get in there and push hard.
Other places of the body where you may see some sinus issues, trapped gas issues, GI tract. If you're experiencing any GI tract issues in there today with gas, just go ahead and release that gas. So, all right, we're at the 30-minute mark right now. If I get a thumbs up from Alyssa and everybody else inside there, we'll head on up. All right, up we go. All right, so we're on ascent. The altimeter is unwinding itself right here. You're able to kind of keep track of the flight today. All of our ascent and descent rates are going to be right about 3,000 feet a minute, unless we have to alter for something. So maybe a little quicker than you used to, but not a whole lot. So we talked about trap gas. Now we're going to see how good Alyssa taught you guys about evolved gas. All right? Kind of put her on the spot here a little bit. So where are some places in the body that we may see evolved gas issues? I can't.
Sinuses?
More of a trap gas problem. Right? Evolved gas would be decompression sickness, stuff like that, nitrogen bubbles, right?
Joints.
Joints, right? Probably the most common one in aviation is the bends, all right? We don't really see bends so much in aviation, but it's more shoulders, necks, elbows, stuff like that. The joints of the body are moving around more, right? Where else can we see trap gas problems? Evolved gas. I keep getting it wrong, too. You can get the chokes, right? You get the bubble formation, the capillaries of the lungs, a lot of pain and inhalation, and it can actually lead to right-sided heart collapse. Skin symptoms, you get that red bubble formation under the skin, pretty red, blotchy, a lot of severe itching. And then you have central nervous system disorders as well. That's that bubble formation in the brain or the cerebral spinal fluid, and those, those symptoms can be anything from confusion to nausea to coma to unconscious coma, same kind of thing. So let's say you have a passenger that you suspect has decompression sickness. How would you take care of that? You're probably the expert now. How would you take care of that patient in the back of your plane? Any guess? What's the first thing you want to do for him?
Put them on oxygen.
You got to put him on an oxygen, on a crew-style mask, tight-fitting, right? Then probably declare a medical emergency, let ATC know what's going on. What else do you want to do?
I think I would head towards a city that might have a decompression chamber.
You got it, 100%. Get him to a pressure chamber somewhere. So one of those bigger cities, I've kind of talked about before today, most big cities with bigger hospitals usually have some kind of hyperbaric chamber at them. Let the airport know to have the right people waiting for you to land. Also, be an advocate for that patient. I spent a lot of years in EMS, and we were always trained that decompression sickness is a diver's disease. Never really a lot of thought to flyers. All right, so I'm worried it's this. This is why I think this, and then be sure that that person gets seen by an AME, flight surgeon, flight doc, whoever you want to call it, there to take care of that. All right, we just crested through 10,000 feet. What I want you guys do is put on your pulse oximeters for me. So grab that probe next to you there. Put it on your index or middle finger on your non-dominant hand with the wire running across the top of your hand, the back of your hand. And then reach down, find the power button. It's about 2/3 of the way down. Press and hold till the screen lights up. All right, looks like everybody's numbers are coming up here. Remember that top number is going to be your pulse ox, and the bottom number is going to be your actual pulse. So, Everybody's looking really good right now. We're just about to come through 15,000 feet here. So what I want you to do is go ahead and drop your masks from the right-hand side, Alyssa, where I showed you what that tab was. If you need help, Alyssa will show you where that is. We're going to leave your regulators on and 100%. So this is the slow onset part here. So we'll leave you off for a maximum here, and then we'll start talking a little bit. So we've been off for about 10 seconds right now. What you can do during this is you can look at those eye charts, see if you notice any change to your vision at all. Still pretty low altitude, so it may take a bit of time for this to kind of come back on.
James, you're already giggly. I hate to see it. You're going to be at 25.
So a lot of you right now, I can see some pulse oximeter numbers here from my side. You're all entering, a lot of you are entering that cognitive danger zone I talked about earlier in class today, where you may not have any outward symptoms, but your brain isn't firing at full capacity anymore. So you're already starting to lose some of that higher function, higher cognition. Anybody experiencing any symptoms yet of any kind? Remember, the early symptoms can be stuff like hot or cold flashes, numbness, tingling, maybe a little bit of mental fogginess. Just the 2-minute mark right now, coming up at about 19,000 feet. James, I don't know if you noticed it right there. You just took a really big deep breath. Maybe a little air hunger, something like that going on with you. We're up the altitude right now where flies generally become walks. So that's a little air resistance we have right now.
You could try whistling too.
If you wave your hand in front of you, you can feel that lack of air resistance. There's 20,000 feet right there. Okay, is anybody experiencing any symptoms right now at all? If you're experiencing just coming, any numbness, any tingling, any hot,
Can
cold
you hear me?
flashes?
Yeah, a little tingly in the hands, but...
Okay, good.
Daryl, what are you feeling?
A little tingling.
All right, so we talked about oxygen saturation before, right? Remember a little bit, right, where what you should be experiencing? Everybody's in the mid to low 70s. Medically speaking, if you're in the back of my ambulance, I'm doing stuff for you right now, but everybody's still conscious, right?
Stevie, you're the last I see. What are you feeling?
I feel groggy.
Remember, if you guys feel too hypoxic, you can treat yourself.
Yeah, your regulars are still on right now. All you have to do is swing the mask to your face and just start breathing normally, and that'll take care of you.
A little lightheaded after a few drinks, standing up, you know.
That's a great way to describe it. A couple drinks, maybe a 6-pack in. I don't know what your tolerance is, but yeah.
Maybe 2 for me.
A little disconnected, maybe.
Disconnected? That's a good way to describe it. Yeah, yep. Remember the barometer is, could you safely fly an aircraft? All right, that's your barometer for when you go back on oxygen.
Stevie, I'm gonna have you go back on.
Easy. Control your rate and depth of breathing when you go back on.
Eric, are you feeling anything at all?
Yeah, just a bit disconnected. Maybe keep your eyes, the vision thing's a little hard to read.
All right, we're back at 23,000 feet. We're going to everybody have go back on. Just swing that mask to your face for me. Start breathing normally, and then see if you notice things getting better for you. Should take about 9 seconds or so, and any symptoms you have may be going away. Steve, you're nodding your head. Did you notice that initially? Yeah?
Feels like immediately coming right back up. Feeling good. Feel like I was floating, but now I'm kind of flat again.
Okay, good. You know, it's really interesting. You can get these, you feel your symptoms more now that you're corrected for it, right? So you kind of have a baseline of what it should feel like here. All right, everybody's recovering here, looking good in there. So I need a volunteer here. Anybody want to try the child shape box? Looks like Chris has a hand up in the air there first. We got 2 of them. All right, good. I thought we only brought 1 in, so perfect.
I snuck the other one in.
Good job. Everybody else, grab a clipboard from the rack in front of you. And at 25 here, in a couple seconds, we're gonna drop your mask again. I'm sorry, listen, everybody recovered? I forgot to ask.
Yes, they are.
Okay, we're going to have you drop your mask again and then start on the demonstrations. We're going to turn your regulators off and normal. So remember, it's all going to be all 3 switches up. Let's go ahead and start the demonstration right now. Those of you with the shape boxes, you need instructions. If we have a hammer, we'll get you one. So, and then go ahead and start those worksheets if you got those. Now the goal with this rapid onset is to recognize your symptoms and then treat yourself for it, all right? We're about 30 seconds in right now.
You can start on that, Stevie, if you want. How's it going, Dale?
Good job, Daryl.
Make sure you just control that breathing, okay?
James, how you doing?
Getting there, struggling with some of these equations.
Any definable symptoms?
Doing okay?
Feeling kind of warm in my chest, actually.
Okay. Chris, how's the shape box going for you?
All done.
Well, empty it out and try it again if you want to.
For me, it just came
All
out
3
like really
switches,
fast.
Chris.
Really fast, yeah? Stevie, why don't you move all 3 switches up for me and swing the mask to your face? All 3.
Chris, I want you,
Red 1, 2.
Eric, all 3 switches up. Mask to your face.
Daryl, you were watching. You see how slow it was getting the mask up, right? It's that new novel situation going on. James, where are you at on that chart?
I skipped a couple because I feel a bit stupid.
Okay.
It's like school, I skip the ones that I know and move to the ones I might have a chance at.
Think you could safely fly right now? All 3 switches.
Easy control your rate and depth of breathing. If your oxygen saturation on your monitor is above 99%, you can neutralize that red switch and turn your pressure off. Looks like everybody for James right now, I'm betting, can go ahead and neutralize that red switch. Oxygen should say 100. So white switch up, green switch up, red switch in the middle. We good, Alyssa? All right, we're going to drop the lights inside there right about now. let you guys start getting ready for your visual hypoxia demonstration. We're going to start a slow descent to 22,000 feet here. When we get there, we're going to have you drop the masks again.
Dale, you went on pretty quick. What were you feeling?
I got really lightheaded, like all of a sudden.
You kind of just stared off into space, too.
Did everybody notice how slow? I know. Daryl was watching how slow Eric put the mask to his face. Did you know this happening, sir, or not?
Did I notice what?
You moved your switches up, and then it took you about 15 seconds to swing the mask up the rest of the way to your face. So kind of lost the SA, kind of lost that novel task I mentioned before, a new task. Will have problems with your hypoxic. So.
Yeah, I kind of felt the symptoms where I just kind of could stop thinking, really. So, I don't know.
Yeah, exactly. You just quit thinking. I can't think of a better way to describe that loss of awareness, what's going on around you.
Chris, you didn't want to give up that shape box. You were holding on to it pretty tight.
What was that?
You were holding on to that shape box pretty tight when I tried to take it away from you.
Oh, yeah, it's pissing me off. Like, the shapes matched up, but the colors didn't match. And so I was looking at it going, where's the color for this shape? To put it in the box.
You're not the first person to notice that, so yeah, it differentiation between the two matching things really kind of throws your hypoxic brain into a bit of confusion. All right, we're at 22,000 feet. We're going to have you guys drop your masks again. What I want you to do when you drop your mask is to get a good baseline of that color chart across from you, all right? See how far down into it you can read, look at your peripheral vision, and see that the colors are very differentiated between the different shades. We'll be off for a total of 4 minutes here. However, if you feel yourself becoming too hypoxic, what I want you to do is just go back on oxygen whenever you want to. But when you do that, swing the mask to your face while you're staring at the color chart across from it, or you may miss it. Remember, it only takes about 9 to 12 seconds for the oxygen to kind of get back up to your retinas where you can kind of see again. So at 4 minutes, we'll do it regardless. But if you feel yourself getting too hypoxic, be sure you stare at that chart while you raise that mask to your face. You don't got to stare at it the whole time. Feel free to look around the room. Is there anything that's changing there? Are the walk-around bowels in the corner still that vibrant yellow, or have they kind of gotten a little dull? Do you notice any color vision issues at all, or maybe you have some graying vision happening with certain spectrums, colors of the spectrum? Maybe Alyssa's shirt isn't bright pink anymore. All right, we're at about the 2-minute mark right now. Just by a showing of hands, is anybody experiencing any visual hypoxia stuff? Do you notice anything different with your vision? Stevie is? Anybody else? A lot of this demonstration is going to be more noticeable when you go back on oxygen. You'll see what's fading and what's changed a lot better that way. Personally, my symptoms here are the blue, the purple, and the green kind of form one big gray blob for me. The other colors are still kind of there. And obviously my visual acuity, the reading down inside the middle of that chart right there, that goes away as well. All right, and there's the 3-minute mark right there. So another minute here, and we'll have you swing the mask to your face while you're staring at that color chart. We have about 45 seconds left. All right, about 15 seconds. Everybody get focused into that chart across from you. Notice any peripheral vision changes with the Z's around the outside. Notice any color changes. Notice any visual acuity issues you may be noticing as well. What I want you right now is grab your mask and don't worry about hooking it up. Just swing up to your face and stare at that color chart across from you. All right, any changes that are going to happen to see by now? Alyssa's going to come around and hook your masks up for you. If you want to avoid any flash blindness here, we're going to go ahead and bring the lights up inside the chamber. So lights coming up in 3, 2, 1, lights. Everybody, if you could for me, we're going to start our descent down to ground level right now. We're done with the pulse oximeters. If you want to take those off your fingers and then go ahead and power down those units just by pressing the power button till the screen goes dark, and gently drape the probes over the top of the unit. Also, because we are in descent, we don't need 100% oxygen anymore, so you take that white switch and just push it down to normal for me. There we go. We're entering the thickest part of the atmosphere right now, so be sure you stay ahead of those ears and sinuses on the way down as well. Now I kind of want to talk to you about what you experienced today, both the hypoxia demonstrations and the visual hypoxia demonstrations. So, Stevie, what did you kind of see today?
Felt like I was drunk, but not as happy as I would be drunk.
All right, I like it. You nodded early on in the vision demonstration, too. What were you seeing there?
The yellows just blended right into the white.
Good way to describe it. Okay. Daryl.
A little euphoria, lightheadedness, and then with the colors, the green and purple were totally blended together.
Did you notice the separation happening when you went back on?
Oh, yeah.
It's kind of a cool trick, right? Yeah, yeah. Also, your symptoms seem to come on kind of all at once. Was that a fair way to describe it at 25,000 feet?
Yeah, I really, within about 10 seconds, I was using that box, and then I just had total brain fog. What am I doing? Didn't even know what I was doing.
Great. Well, not great, but good that you have those symptoms, I guess, right, Chris?
I noticed the color wheel kind of looked faded, when you wash your clothes a bunch of times, and then it came back bright, going back on oxygen.
How about your hypoxia symptoms? Anything notable?
Maybe one of you were saying, just task driven, like I have to get this done, and with the box, and yeah, just I wanted to finish that.
Fair enough. James, how about you?
The colors I could read down to this spot, and then I was really struggling and focused on that line. I knew what it was because I could remember, but I couldn't read it. And same as Daryl, the purple and green blended together, and I lost the Z's. But those came back as soon as I put the mask on.
How about your rapid onset hypoxia? What symptoms were you having?
Definitely the tingling. My chest felt kind of light. Actually, all of me felt pretty light. It was very similar to getting tipsy or something. That's kind of the way it felt to me. But yeah, that was really about it, to be honest.
Okay, those are good recognizable symptoms. If you ever just feel drunk when you're flying, it's probably a bad sign, right?
Yeah, both ways.
How about you, Eric?
Yeah, as far as the colors went, it's just they went very crisp, and then a big difference when I went on the oxygen, definitely more distinguished. And then as far as the hypoxic, just in general, just lightheaded, and then as I got more hypoxic, just a lack of drive or motivation to complete task. I kind of accepted that as normal.
Okay, all right. We're below 10,000 feet. You can drop your mask on the right-hand side. If you need a hand, let's help you out with that. And you can post-flight these regulators for us and appreciate it. So green switch down, white switch up, red switch in the middle. If anybody needs a Kleenex for anything, you're blowing your nose, taking care of something, Melissa is busy passing them out. Overall, a worthwhile experience today. Remember your post-flight restrictions today as well. Remember what those were from before?
Exercise, drinking. Those are the two that I remember.
We take all the fun away for the next 12 hours of your life. So at 3 o'clock in the morning, feel free to exercise with a beer in your hand while you're flying a plane.
You can just wait for that until we get to the ground, but we'll have you guys clean it out, and we do it again afterwards. But
Yeah, it really kind of sucks to start wiping these masks out when they're still in your face, get that alcohol whiffing and stuff like that. It's no good for anybody. But yeah, when we do get down on the ground, we'll have you disconnect everything, clean your masks out real well around the inside, get behind the comfort roll inside there, clean the ear cups out too. James, your sinus is doing okay? Yours doing okay? Just double checking. All right.
was it worth the nerves?
Who was kind of not scared but nervous about experiencing this stuff today? It's okay. It's a completely new experience, right?
Yeah, once we were doing it, I was fine though. It was just the anticipation.
Like I said this morning, everything is easily predictable. We have some of the best people in the world taking care of this, watching you inside, and be sure nothing untoward happens. If you go unconscious in here, you lose all the learning, right? So we really try to avoid that happening all the way around. Alyssa's seasonal allergies are back, so I'm kidding. You guys have any big plans for the night?
Not anymore.
I just ruined your evening, I guess, so yeah.
He meant the gym. He was going to hit the gym. It's leg day for him.
Never skip leg day.
Actually, I was.
Do you know why we have those restrictions on you? Alcohol and CNS, decompression sickness, look a lot alike. And then if you get the bends or something and you're exercising, it can kind of cross over too, right? So we don't have somebody make a determination if you're drunk or have CNS issues, or if you have bends or you just got to pull the leg muscle or something while you're running. So, and obviously flying, going up to altitude again after being at this state isn't the best idea in the world. So, kind of re-exposes you to possible decompression sickness again. Overall, really good flight today. No problems here. We'll be on the ground here in just about 1,000 feet or so. So if you guys want to start disconnect everything, start cleaning your gear up, we'll see you on the outside here in just a little bit.